Friends, welcome back. Let me get my microphone into place. Welcome back to another episode of Bariatric Foodie Live, sponsored by bariatricpal.com. I want to start off by addressing the most obvious thing you're probably going to notice tonight, which is that it's just me. It's just Nick. Shannon is not feeling well today, and can you hear me now? If you can't hear me, try going out and going back in. Let me type that. Um, but if anybody can hear me, let me know, because I would like for you to be able to hear me, because I have a story to tell, folks. So if you're on here, I think I only see two people. Okay, you can hear me now. Okay, great. I'm glad, because that is important. Okay, so I am hoping that we have a good turnout tonight, because this is a really important conversation, and it's a conversation that every time I have it, people tend to like scatter. They're like, gone. We don't want to talk about this. I was watching listening to an episode of a podcast that I like very much called Hidden Brain. And in that podcast, the host was talking about how we sometimes avoid information that's very important and useful to us, because it's information that might upset us or scare us. And so I totally get that mentality. However, October is Breast Cancer Awareness Month, and I think we need to have a conversation about breast cancer. We need to have lots of conversations about breast cancer, so that everybody knows what they need to know in order to know whether or not you are at risk for breast cancer, to be able to detect it, and to be able to seek treatment for it. So we are going to have this conversation. I would reckon we're going to have this conversation at least every October, if not more frequently. And so regardless of whether we get a great turnout tonight, the show will go on. So before we get to that, I always have to do a shout out to our sponsor, bariatricpal.com, which is, if you've never been there, a wonderful, wonderful website that has all of your bariatric products, all of your bariatric needs. They just came out with a new protein that Shannon and I reviewed a couple of weeks back. And you can find that protein review on the Bariatric Foodie YouTube channel. Search Bariatric Foodie YouTube channel on YouTube. Subscribe to the channel, and then check out the Bariatric Pal Protein 1 product review. That is a protein, multivitamin, and fiber supplement all wrapped up in one. Shannon and I tasted all 4 flavors in one show. It is a hilarious show, and you will be able to see what Protein 1 is all about. Now, heads up, if you watch next week, Bariatric Pal and I have a present for each and every one of you. And yes, it is an actual present. It's something that you actually receive. So tune in next week, because I will be telling you more about the little present that we have for you next week. So with that, I wanted to just jump right in and get started. Now, you are free to ask questions anywhere along the line that you want to, as I go through the information that I'm going to go through. However, I will have what I call burning questions at the end, and that's your opportunity to have my undivided attention and questions. Now, a couple things I wanted to mention before we get started. Number one, some of this information is going to go a little bit below the surface. I'm not going to get like super graphic about medical stuff, but this isn't necessarily the show to have like your kid on your lap. Number two is that I am not only going to be telling my story, but I'm going to be sharing some important information that I think you need to know too. So it's not going to be me sitting up reminiscing about the past 2 years of my life only. I'm going to throw in some information that you need to know, and also my personal takeaways, having looked back on that time in my life. And then lastly is I don't know everything about breast cancer. I use the publicly available information, and I know what I know based on what I went through. But I am not the leading authority. I'm not the first or the last. If you have any concerns at any given time, you need to go to your physician. This does not constitute medical advice. I'm not a doctor. I don't play one on TV. So with that, if you wouldn't mind, because this is an important conversation, and I'm not exactly sure how many people are on this live. On my side, I see between 4 and 5. That's actually pretty low. So I'm wondering if you know of a woman who could use this information, a woman in your life who could appreciate this information, or that you want to be informed about breast cancer, just hit the share button to share it out on your timeline so that you can share this information with other people. And I hope that it is helpful to you. So, as you know, probably, October is Breast Cancer Awareness Month, so that's sort of the catalyst for me talking about this now. I debated whether I was going to talk about it on the anniversary of my diagnosis, the anniversary of my treatment, what I was going to do. However, I decided to talk about it during October just because there's just so much going around for Breast Cancer Awareness Month, and I feel like I have a unique voice in a couple of ways being a post-op, so I wanted to reach out to you to let you know how the experience of breast cancer was, a teeny bit different based on the fact that I had weight loss surgery. So I'm going to go through those points too. I also wanted to hip you guys to a really good and resourceful website, which is the National Breast Cancer Foundation, which is nationalbreastcancer.org. They have a lot of very good information. They have videos, they have downloads of information. They explain things in terms that you can understand. Anybody can understand. And that was one of my go-to resources when I was learning about breast cancer, when I was going through my own diagnosis process. I would often go to this website. I would use their resources. They have support resources. They have informational resources. It's just a really good website. There's a lot of cancer websites, so, do searching around, but that's the one that I personally recommend because I've used it myself. And I actually went through the entire website and their entire about breast cancer section to prepare for this episode, to make sure that the information that I'm giving you is good information. I don't want to be giving out false information. Okay, so I have divided this conversation into 3 parts. Part 1 is going to be about the diagnosis process. Part 2 is going to be about the treatment process, and then part 3 is going to be about sort of the afterlife of treatment process. I always call it bariatric afterlife. So now I also have breast cancer afterlife. I'm living 2 afterlives, people. Afterlives. Blah. Anyway, so let's hop right in. Okay, so diagnosis. Let's talk about diagnosis. Most people, when you think of how breast cancer is diagnosed, think of one of 3 ways that it gets diagnosed. The first being that you did a breast self-exam. Wherever you would do a breast self-exam, you find a lump, you get it checked out, and you find out that it's cancerous. That's number 1. Number 2 would be you're in the doctor's office and your doctor gives you a breast exam and they find a lump, and you go through with the testing and find out that it is cancerous. And then the third one is that you have a mammogram, a routine mammogram, and the mammogram results come back abnormal. And in researching that, you find cancer. So first thing I want to say is, in the grand tradition of Nikki being a weirdo oddball, that is not how any of my cancer was. None of those was how my cancer was detected. My diagnosis story personally has a couple of different sort of dynamics to it. The undercurrent running through that dynamic is the fact that I have a history of breast cancer in my family. My grandmother died of breast cancer when she was 49 years old. She had gone through a few rounds of fighting with it, and she finally succumbed to it when she was 49 years old. My great aunt also died of breast cancer. Her sister also died of breast cancer, and I think she was maybe just 51 years old. And so that left my grandfather a widow. He never remarried. That left my mother motherless, and she was an only child. And she was actually in her early 20s, or no, mid 20s. I was a little kid, and she was left without her mother. So it had a great effect on her, and it had a great effect on my grandfather. But one of the effects that it had on both of them was to raise me to make sure that I knew things about breast cancer, that I knew that, I was supposed to be getting tested. I was supposed to be getting mammograms. Mammograms are very important, and things like that. Just basic information. So my family would, throughout my life, share a lot of different information with me about breast cancer, just so I could be aware, just so I would know to go to the doctor and, do my routine testing and things like that. However, what ended up happening was that I had a little problem that I discovered. And the first time that I noticed it was when I was about 3 years ago. So I was 37 years old. And I'm going to warn you, if you're like a squicky person, brace yourself. I'm not going to go too far into the squick, but if you're a squicky person, brace yourself. So I had something called an intraductal papilloma. And an intraductal papilloma, the way that it was described to me, and this is an interesting description, but the way it was described to me is that it's a little cauliflower-shaped growth that is inside your milk duct, and it can rupture and it can emit things. And what it emitted in my case was blood. So I was bleeding from my breast. And I think this had been going on for some time, because when I first discovered it, when I first saw it, first of all, it freaked me right on out, as you can rightfully imagine. But then as I started looking at my bras and things like that, I noticed that there's like little dots on the inside. So I think it had been happening on a small scale for quite some time. So I go to my gynecologist and I report this, and they sent me in for a diagnostic mammogram. And I got the diagnostic mammogram, and there was sort of a lot of rigmarole. That doctor's office didn't really have it together, so they kept asking me to do weird things. I got the results of the mammogram, but they were inconclusive. So then they told me to get a mammogram on the same side again, and the imaging company wasn't sure why they had sent me back and things like that. So the main thing to know about this is that when my healthcare providers are not in a groove and they don't seem to be very well coordinated, I have a tendency to check out of the process. And that is exactly what happened, is that I checked right on out of that process. That was about in 2014, 2015. And so I went on about my business, and I sort of buried my head in the sand about it. Fast forward about a year and some change later, to December 2015. I was looking for a primary care physician, and a friend of mine works in a hospital with a lot of doctors. So I asked her to recommend a doctor who was like a no BS doctor. Those kinds of doctors, those doctors that expect you to be at your appointment, expect you to go get your tests, expect you to do all of these different things. I need a doctor like that, because I need somebody who's going to hold me accountable to myself. So I went to go see this doctor for the first time, and he's, how you go to a new doctor and they're asking you stuff. They're asking you, what kind, are you having any problems? What's going on with you? And so I reported this, and he immediately said, you need to get this checked out. So I went to the man who eventually became my breast surgeon, and I got it checked out. And again, I had to get a mammogram. Now, let me stop here and talk about mammograms, because I think that probably for the folks who are tuned in live here, you've probably experienced a mammogram before. But if you are tuning in after this live or at any given time, and you are either not old enough for a mammogram, or you have not gotten a mammogram yet, let's just talk about that. What is the age that you are supposed to get a mammogram? I think you guys in the audience know, and you can type it in, but according to the National Breast Cancer Foundation, you should get start getting mammograms if you don't have any risk factors in your family. You should start getting mammograms at age 40. You should have them every 1 to 2 years. That's up to your doctor. It can be 1 year or it can be every other year, but you should start getting them at age 40. If you have risk factors, it's a little bit different. You need to discuss it with your doctor. So what's going to happen is you talk to your doctor, you tell them, I have a history of breast cancer in my family. I'm not 100% sure when I'm supposed to start getting a mammogram. They will help you. Now, the information that I was given, and it actually matches what's on the National Breast Cancer Foundation website, is that if you have an immediate family member like your mom who got breast cancer, who was diagnosed with breast cancer, the recommendation is that you start getting screened 10 years before the age that they were first diagnosed. Now, if it's somebody like me, in my case, it was my grandmother, there is still a little bit of an increased risk, but it's not exactly the same type of risk as if it was my mother. I probably was doing the right thing to start at 40, although I'd asked my doctor. He said, you can just go ahead and start at 40 based on when my grandmother was diagnosed, and that's the way I proceeded. However, that's the recommendation. If you don't have any other outstanding risk factors, you don't have anybody in your immediate family who has been diagnosed with breast cancer, 40 years old, and you get your mammogram every 1 to 2 years based on what your doctor thinks is best. If you do have risk factors, you need to discuss it with your doctor because you may need to go in early. Like my daughters will start getting screened for breast cancer at 29 years old because I was 39 years old when I was diagnosed. So that's who should get a mammogram. So far as the process of a mammogram, I heard all these horror stories. And the first time I went for a mammogram, I was scared witless. I didn't know what was going to happen. I thought they were going to mangle and tangle me, and I thought it was going to be horrible. But I don't know. I don't know how the experiences vary based on like your chest size. Guys, weigh in if you have anything to say about this. But based on your chest size, or how big or small you are, I don't know if the experience varies. But for me, the mammogram, it wasn't that bad. Yes, you do have the distinct horror of watching your breasts pressed down into a flatter, like you didn't know your breasts could be that flat. When you're looking at it, you're like, my God. However, it wasn't painful. It wasn't like the most fun thing I ever did. Yes, it was a little uncomfortable, but it wasn't bad on the overall. You would go to the mammography place. There is a machine. Usually there's a tech there who's adjusting things and getting the machine ready for you to go into it. You place your breast on a plate, and then there's a plate that comes down and systematically sort of smooshes your breast out into this flat disc. And then images are taken of it, and those images are examined to see if there's any abnormalities. So if there's no abnormalities, usually I can tell you, like these days, nowadays, they can tell you that same day if there's any abnormalities, and you just go on about your business. But if there are abnormalities, then you would find out about it relatively quickly these days. So anyway, so that's the whole process of getting a mammogram. It was not bad. I've only ever had diagnostic mammograms though. So routine mammograms, I'm thinking, are probably quicker. A diagnostic, they usually want to get your breast from like multiple angles, and you got like this, and you got that, and this, and so it can get a little bit like acrobatic, but it wasn't that bad in the grand scheme of things. So like I said, went to the new doctor. He sent me for a mammogram, and I went for the mammogram. And like I said, I was waiting for the results. The results came in, right then and there. I had to wait about 20, 30 minutes or so. And almost immediately they said to me that I needed to have an ultrasound. And that's usually a follow-up. If there is something abnormal going on there, they're going to want to follow up with more tests. It may not necessarily be an ultrasound, but that's what it was for me. So they did an ultrasound, and the ultrasound tech, it's interesting because all the ultrasound techs I've ever had have like these really serious poker faces because they don't want to like freak you out. But she was going through my ultrasound and she starts grimacing and grimacing, and I'm getting worried. I'm like, oh crap, what's the matter? And so she basically said, you need to see your doctor as soon as you can. So I called my doctor. And the very next day he wanted to see me. The very next day he brings me into the office and he says, you need to get those first mammogram films that you had a year and some change ago. So I go get them. They compare them, and what they found on the mammogram was not a lump. There's still no lump coming into play here, but was what's called calcium deposits. And calcium deposits are precursor can be a precursor to breast cancer. I had a lot of them in the mammogram that I took in 2015. So they were looking to compare it to the one I had in late 2014. And so I had them in late 2014, but it wasn't enough of them, and they weren't like clustered together in such a way that it raised anybody's attention the first mammogram go round. So now I got two issues because I have the intraductal papilloma and now I have the calcium deposits. So basically, through some other testing, my breast surgeon determined that, it was very likely. They can tell you pretty early on through testing whether the likelihood that what you're experiencing is cancer. There's a scale, I believe it's called the BIRAD scale, but don't quote me on that, where if the higher it is, the more likely it is it's a cancer. So mine was very likely a cancer, and I was told that up front. What they didn't have was a cancerous mass. So I went through a couple of other things. We went through, I think the first thing that we went through was another sonogram. I also had what was called a lymph node aspiration, which is basically what it sounds like. They stuck a needle in my arm. They gave me anesthesia, stuck a needle in my arm, and withdrew some lymph fluid from one of my lymph nodes to see if there were cancer cells in there. Interestingly enough, everything we were doing was coming back negative. I had, the ultrasound, I had the lymph node aspiration, and then finally I had a procedure called a stereotactic biopsy. And you guys got to Google that one to see, because you will not believe me if I told you what a stereotactic biopsy is. But basically, a stereotactic biopsy is for when they were looking to test the tissue around one of those calcium deposits. And the calcium deposits are itty bitty, like little sand-like things, right? And so it's not something that the human hand can just go in and draw out. So basically, the setup is this. Picture it. Nikki. In the doctor's office, there is this table. It's about 4 feet off the floor. So, you have to go up these little steps to get there. You lay flat on your stomach, and there's a hole there. And your boob goes through the hole, right? And basically, underneath the table, there is a machine that that takes an image of your breast, sees where the calcium deposits are, and goes in with a little needle that grabs a piece of your tissue and comes out real quick. Now, I had anesthesia, so it didn't really hurt that bad. But it was one of those things that was just phenomenally, like one of the many phenomenally weird things I went through during this entire process. But that, like, I'm talking about, the ultrasound came back where they couldn't find any cancerous mass. The lymph node aspiration came back, no cancer cells. The stereotactic biopsy came back, no cancerous cells around the calcium deposits. And all the while, my surgeon kept telling me not to, jump up and down for joy at these test results. Basically, he said, you have cancer, we just can't find it. Let's just pause there for a moment to think about what that feels like, to be told that you have cancer, but we can't find it. And so that was a little bit worrisome. One of the things that I think was interesting and that played a part in my cancer diagnosis, and even my breast surgeon said this, is because I had massive weight loss, the composition of my breasts was a little bit interesting. There was fat, but then there was like places where there was really nothing. There was places where there was just skin. And so the composition of my breasts were all over the place. Before I had surgery, I was, are you guys ready for this? I was in a 48H cup. H, like, his, her, Herman H cup. After I had surgery, the lowest I went down to was a D cup. And by this time I was a double D because I'd had some regain and some of it was in my boobs. My breast composition was all over the place. And this was another reason why doing breast self-exams was a little bit weird for me, because of the fact that there was stuff in there. It's like, my breast would move all over the place. There's a lot of skin. I didn't know what I was feeling. I didn't know what I was supposed to be feeling. So it was very, very confusing. I'll talk about what my doctor told me about that in a bit. But, basically the next step after the stereotactic biopsy was to do a full-fledged biopsy where they put me under anesthesia, they put me to sleep, they go in and they take a piece of breast tissue. And that is when they found the cancer. And so that was sort of the point, the point from me noticing there was a problem through that intraductal papilloma to being diagnosed. The interesting part about biopsy is it's interesting because another thing that affects you, it affects all women, but I felt like it really affected me, was that after I had the full-on biopsy, my breast was not the same shape. There was because they took a good chunk of tissue out, there was sort of a big old dent in my breast. And it was interesting because, you guys can relate that we already have issues about how our breasts change after weight loss surgery. When you lose the weight, a lot of women, who have had weight loss surgery tend, to choose to have breast surgery to, either lift or reduce or take some of the skin away or do implants or whatever it is you do. So that really didn't help my conception of my breasts at all, is the fact that I now have this big, visible dent in my breast, but it's okay. It's okay. So I just wanted to sort of give you a couple of takeaways from each stage that I'm talking about. So for my diagnosis stage, there's a couple of key takeaways that I had about the process. Now, looking back on it, of course, hindsight being 20/20. Takeaway number one, obviously, is that not all cancer is detected using self-exams or mammograms. I point that out because not only because mine wasn't detected that way, but also to say that if you think something is wrong with your breasts, especially if you have like with my thing, I had an intraductal papilloma, which meant I was bleeding from my breast. That is clearly not supposed to happen. If you have something that's wrong that isn't a lump, isn't, coming up in your mammogram, talk to your doctor. Tell your doctor about what's going on and get it checked out. Do not bury your head in the sand. Don't, dismiss it as, it's just nothing. Go to the darn doctor and get it checked out. So that's takeaway number one. Takeaway number two, I just said that. If something is wrong, it's important not to bury your head in the sand. I can't stress that enough. I know sometimes it's scary. I know you're scared that it might actually be cancer, but the only thing that you really have on your side in these situations is being empowered to find out, and the time. Time is of the essence with cancer diagnosis. So you don't want to rob yourself of any time. Go get it checked out. Takeaway number three, which I'm going to talk about throughout, is have a person who is there for you through your diagnosis. And what I mean about that is they're not there for themselves. They're not there for their own peace of mind. They're there for you. They're there to be your eyes, your ears, asking questions that you maybe haven't thought of asking, pointing out things that maybe you have not seen. I had a person, she is a dear friend of mine. She's also a post-op. We've been friends for years and years and years, went to every single appointment with me. She was the same one who recommended my primary care physician. And it was just so helpful. I can't underscore how helpful it was to have her there because the process was overwhelming. And there were plenty of questions that I forgot to ask. And she was there to remember them. She was level-headed. Of course she was upset because this was happening to me. However, she had that outside perspective of being able to, she wrote down everything the doctor said. She wrote down all the instructions. She wrote down questions that she had. She would ask me questions about how I'm feeling, but she was there for me to be my ears, my eyes, my support system wherever I went. So if you can, if you can be that person to somebody else, or if you ever, go through this, get that person in your life and bring them with you. So with that, let's sort of move into treatment. So Nikki finds out that she has breast cancer. Now, pop quiz, guys. How many stages of breast cancer are there? How many stages of breast cancer are there? I want to hear you guys weigh in, and it's going to take a minute for me to see these answers, so I'm going to keep going with it. But I found out that I had breast cancer, and I will tell you that the very first thing that I felt was relief. Relief. I know that sounds funny, but after having been told that you have cancer but we can't find it, it's a relief to know that you at least found it, because you can't find it means it could grow and we can't find it, and maybe it'll be too late when you can find it. But when they finally did find it, I was like, okay, they found it. Now we can move forward. I'm going to award the prize to Margaret Van Bruggen, because she is right. There is 5 stages of breast cancer. And I did not know this until I got breast cancer, because I was diagnosed with stage 0. There's 0, 1, 2, 3, and 4, which means 5 stages of breast cancer. Stage 0 breast cancer is typically called ductal carcinoma in situ, DCIS. DCIS basically means that the cancer is still localized to your breast. Most of the time, it's localized to your milk ducts in that general area. It probably hasn't moved to your lymph nodes. The way you progress through stages of cancer is based on 2 things. Number 1 is the size of the cancerous mass in your breast, and number 2 is where it is in your body, whether it's still in your breast, whether it has spread to your lymph node. I don't know why I point to my shoulder when I talk about my lymph node, but whether it's still in your breast, whether it has spread to your lymph nodes or outside of that general region to the rest of your body. Of course, we think of like stage 1 and 2 being, the 1 and 2, I believe, are, well, 1 I know is still in the breast, but it's a little bit different than stage 0 because of the size of the cancerous mass in your breast, and it may have spread to your lymph nodes. Stage 2 can be in your lymph node in a bigger mass. Stage 3 is where it starts to come out of the breast. Stage 4 is generally how do I say this? Stage 4 is the point at which cancer is incurable. Like at stage 0 where I was in, it's highly curable. At stage 4, it is incurable. However, medical intervention can come into play to help you manage and elongate your life. So it's not necessarily you are going to pass away within the next few months or whatever if you have stage 4. It really is, an individual thing for you and your doctor to talk about. So I was diagnosed with stage 0, which I didn't even know existed before this. My grandpa didn't tell me about that. I had, like I said, it is highly treatable. So basically, after they found the cancer, my breast surgeon got together with a couple of different kinds of oncologists, and basically they have this meeting that's called a multi-D meeting, multidisciplinary meeting. And basically at that point, they lay out all of your test results. They talk about everything. They, this is, how old she is. This is what kind of cancer it is. There's cancer can be hormone responsive or hormone non-responsive, which means that, the presence of estrogen feeds the cancer versus, a hormone non-responsive, which wouldn't. There's all of these different factors that they discuss. And basically, they get together on a day and they just discuss your case. And then you come in at the end of it and they present what they think your best treatment options are. So I went in with my person and by that time, let me just stop here and warn you of the pitfalls of using Dr. Google. Dr. Google can have your life all messed up, guys, because Dr. Google had me going in there very cavalier, easy breezy. I just knew what they were going to tell me. They were going to tell me that I needed to do radiation, maybe I would have to take some medicine, and everything was going to just be fine. It's fine. It's fine. And as you can see, I'm still talking to you here. So I am fine today, but Dr. Google didn't quite prepare me for what I heard at my multi-D meeting. I go to the multi-D meeting and I was in fact offered two options. Option number one was that option that Dr. Google sort of gave me, which was that I could get another biopsy to remove the whole cancerous mass that they could find. I would have to get tests to make sure that that's all the cancer that was in there. I'll talk about that process in a minute. And then I would have to go through a course of radiation. Radiation lasts several weeks. You go every day. It has some side effects, mainly discomfort, raw skin. The breast can change in size and change in shape and things like that. So you have uneven looking breasts and things like that. So I was told that I would do a course of radiation after having a full biopsy, and that I would probably have to go on a drug called tamoxifen for my treatment after that, to get rid of the remaining cancer and all of that good stuff. I may or may not have to go on hormone therapy after that, and what else? That I would have to be monitored very, very closely. And the doctor said that basically my chance of recurrence was about 30 to 35% at that point if I went with option number one, right? So I was prepared for that option. I was like, yeah, Dr. Google said that this was what you were going to say. Yeah, okay. Option number two punched me in the gut. And you guys know how much I talk. Option number two rendered me speechless. And so option number two, option number one was the biopsy and the radiation, taking the tamoxifen, being monitored very closely, blah, blah, blah. Option number two was, or you could have both of your breasts removed. And I was like, what? Wait a minute, rewind, back up, rewind. First of all, it took me a moment to come back to myself. Like that recommendation actually sort of knocked me out of my body and back in. And so my good friend who was with me, she sort of like put her hand on my knee. That sort of brought me back to myself. And so I think I looked a little bit like deer caught in the headlights at that point. But what my doctor explained to me was that there were several things that made him make that recommendation for me, one of which being the age at which I presented for breast cancer. I was very young to have been diagnosed with breast cancer. I was only 38 going on 39 years old. Number two is that I did have a familial history of breast cancer, and I was upfront with him about that. Number three is that I had a hormone responsive breast cancer. So the presence of breasts produce estrogen. So the presence of breasts is going to produce estrogen. And since we know estrogen was feeding the cancer, that sort of put me at a little bit of a slightly higher risk. And so those were sort of the factors that made him suggest that second option. And he said, basically, the second option, we would put your risk of recurrence at about 2%. So I could keep my actual breasts, and one would be a little different. I would have to go for monitoring, I'd have to go for radiation, all that good stuff, or I could have both breasts removed and drastically reduce my risk. Now, I want to tell you guys that my decision was not made particularly easily. And I think that my doctor, one of the wonderful things, if you've ever had a good good healthcare provider, you know that they care about you as a person first. So basically, this meeting concluded. He left the room. The oncologist left the room. And by the way, side note, when you're getting diagnosed with breast cancer, it becomes absolutely nothing to be in a room full of healthcare professionals with your shirt off. Nothing. So I'm sitting there shirtless, shocked, and I'm quiet. And my good friend is quiet. She's sort of giving me my space, like, okay, I don't know if she's going to freak out or what's going to happen. But then about 5 minutes later, my surgeon came back in and he said, Nikki, he's like, I'm not going to advocate one choice or the other. I will go with whatever you choose. However, I want you to know exactly what's going to happen if you choose each option. So then he flipped over a piece of paper that I was given with information options or whatever that was blank. And he actually drew me a flow chart. Like, if you go with option 1, this is what happens. If this comes back positive, this happens. If it comes back negative, this is what this happens. You know, this whole flow chart. And he said, what I want you to do is I want you to take this home and I want you to sit with it for a couple of days. We're going to, come back together in about 4 or 5 days. And I want you to just look at this and think about it. Look at it and think about it. And so I did what Nikki does very well, which was I sort of avoided at first thinking about it. And the first way I sought to avoid thinking about it, which, by the way, I think is a good thing to do overall, but not as an avoidance technique, is that I asked to be tested for the BRCA1 and BRCA2 genetic mutations. Now, what are those? Those are genetic mutations that have been found through research to have a very high correlation with both breast cancer and ovarian cancer. Now, if you have those genetic mutations, it is not a given that you're going to have get cancer. That just means you are at a way higher risk of cancer, and you will probably be guided into particular actions just for early detection or even like prevention, like extreme prevention methods. The most famous example of this, of course, is Angelina Jolie. Angelina Jolie tested positive, and I don't know whether it was BRCA1 or BRCA2 or both. Her mother died from breast cancer. She found out that she had the genetic marker, and she chose not only to have a full hysterectomy, but to also have both of her breasts removed. That's called a prophylactic mastectomy. Prophylactic meaning you're preventing something from happening. When you have the BRCA1 and BRCA2 genetic mutations, I'm going to say many insurance companies, because I'm not sure what the landscape with crazy healthcare now, so don't quote me on most. But I will say my insurance company would cover a prophylactic double mastectomy and reconstruction because of the fact that I had those 2 genetic markers. So I chose to get tested for that. And part of me in my head thought that I was going to make my decision based on whether I had the genetic marker. I don't know why, because it really doesn't matter if I had the genetic marker or not. I already have cancer. So, but a couple of things I wanted to say about the genetic mutations is, number one, if you are found to be positive at a certain point, like for me, I have two daughters. You guys know this. I talk about them all the time. They would eventually be tested for those same genetic markers. I have a niece. She would be tested for those genetic markers. I have a brother. He also would be tested for those genetic markers, because, little known fact, men can get breast cancer too. It is not as common as women getting breast cancer, but it can happen. And from there, we would have gone through a course of, figuring out whether or not I needed to get a mastectomy, whether I needed to get my fallopian tubes and my ovaries removed, and all of these different things. So my breast surgeon did sort of gently remind me that time was sort of the essence. And he wasn't rushing me. That's the thing about cancer, though. It's progressive. And what he knew was that for at least 1.5 years, I've had the early signs of cancer. I had stage 0. He didn't know how it was going to progress. So he's wanting me to sort of make an informed decision and not dilly-dally. Thankfully, the results came in pretty quickly. I do not have the BRCA1 or BRCA2 genetic mutations. In fact, the genetic counselor told me about 95% of women do not have those genetic markers. So I'm glad that it's pretty rare, because that's quite a decision to have to make if you're not already sick, to decide whether or not you're going to have your breasts removed prophylactically. I would imagine that's a very tough decision. But I was also thankful because that meant that, I had a few less decisions to make. So I think you guys already know what decision I made, unless you're new to Bariatric Foodie, which is that I did decide to undergo a bilateral mastectomy. Why did I decide to undergo a bilateral mastectomy? Well, a couple of things I kept in mind. One was that I thought of my mother. My mother passed away in 2012 from complication of diabetes, but one of the things that sort of marked her life and was very significant to me in my childhood was the pain of losing her mother so very early. My mother was in her 20s when she lost her mother. She felt she was too young. I didn't grow up with my grandmother being around, and I grew up with that sort of sense of loss from her being there, because it was just so tragic the way she died. And so I thought about my own daughters. I thought about whether or not I was going to wanted to take the risk that I may not be around with my own daughters. I thought about my grandmother, because she underwent a treatment, and then the cancer came back, and she did eventually succumb to it. So that was one thing that I considered. A second thing that I considered, which was sort of ultimately the bigger deal in my mind, which was my own quality of life. When you look at like the chances of the cancer recurring, 30 to 35%, it may not seem like high odds, but that's 30 to 35% that it could come back. And for me, knowing myself, knowing how I process stress, how I process trauma, how I process fear, it was one of those things where I really had to ask myself, in addition to, the risk of, it coming back, me succumbing to it, my daughters being left without a mother, and all of those different things, is also, the fact that that's not how I wanted to live my life. I didn't want to live my life fearing the cancer coming back. And I knew that that would be a big, 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 big part of my everyday life if I chose to go with an option with a higher risk of recurrence. Now, did they have to recommend a double mastectomy? No. There's been lots of articles since I've had my surgery about how mastectomies are overprescribed and things like that. I don't know if that was the right option for anybody else, but I know that it was the right option for me. So I decided to go with the bilateral mastectomy, and we went from there. The one thing that I would say as a post-op sort of defined this process for me, it was interesting, was that in leading up to me going the diagnosis process, I had started losing weight involuntarily. And let me just tell you, I'm very honest. I'm here, Bariatric Foodie. I've always been the same. I'm very honest with you. I'm going to be upfront with you. I wasn't doing anything to lose weight. I wasn't exercising. I wasn't exercising any more or less than I ordinarily do, which was, kind of exercising, but I wasn't hardcore. I wasn't, eating dramatically less. I wasn't, doing anything to lose weight at the pace that I was losing weight. And so before I really got into the full swing of my diagnosis process, I expressed that concern to my primary care physician, and he actually congratulated me. He's like, "Congratulations, you actually needed to lose a little bit of weight. So you're doing it. You're great. You're wonderful." And I was like, "No." No, I didn't do anything to lose this weight. Unexplained weight loss is not a good thing. And so it took a little bit of prodding and stamping my feet to get him to listen to me. And when the diagnosis came through, even though there is not necessarily a direct correlation to, you had stage 0 DCIS and you are losing weight. My breast surgeon even said at that point, it wouldn't have directly contributed to a bunch of weight loss. What could have happened was that my metabolism changed because something changed in my body. But my primary care physician had sort of an aha moment about the fact that unexplained weight loss is just never something that you should ignore. And so he sort of made a pledge to himself that if anybody, no matter what size, came to him with unexplained rapid weight loss, that he would, check it out. He wouldn't necessarily assume that, it's like, yay, they're losing weight, which I thought was pretty significant that he owned up to that. So anyway, takeaways from my treatment process. Number one, ask as many questions as you want or need to ask. I can't stress that enough. Ask as many questions. Don't think you're taking up too much time. Don't think ask the same question over and over again if you don't understand the answer to the question the first time. Like I said, I had my person there with me asking questions, but there were questions that I had to ask over and over and over again until I got the significance of what was happening or what I was being told. So ask as many questions as you want and need to ask. Number two, acknowledge your fear. That's one of the things that I didn't do. I was very stoic in the beginning, and I'm going to tell you in a minute how that ended. But it's important to acknowledge your fear, even if you're not necessarily talking to anybody. I would highly recommend you talk to somebody. There's most hospitals have cancer support groups. You can also, the hospital that I had surgery with actually matches you up with somebody who had the same diagnosis and treatment as you did. And so I had her as sort of a mentor to listen to me, that I could vent to. I had my friend who was my person, and things like that. But then I also did things like journaling and things like that, just to get those thoughts out of my head a little bit. And then takeaway number three is that your best option is yours. So one thing that tends to happen when you start, and this is the reason why I was very quiet about my diagnosis. I announced it here on Bariatric Foodie, and I announced it to my family and friends once I had decided that I was going to have the mastectomy. I did not tell a bunch of people beforehand. I did tell a small select, like my boyfriend knew, my children knew I was going through that process, and my person knew. Yeah, Christina, see that point that I made earlier, have a person, take them with you. But that core group of people knew, but everybody in my family didn't know until I already decided to have the mastectomy, because of the fact that people have a tendency to sort of give you unsolicited opinions about what they think you should do about your health. And I really needed to make sure that I was doing the best thing for me. So I kept that information very close because I knew my best option was mine. Some people might have said, well, it's not necessary to have a mastectomy. My brother's sister's grandma did this or whatever. Look, I'm happy for them, but my best option is mine. So those are my main takeaways from the diagnosis process. So let's talk about after treatment. So I underwent, on May 5th, 2016, I underwent a bilateral mastectomy with partial reconstruction. And I will never forget the day that I went to the hospital. First of all, when I told my family, and I apologize because we're probably going to run over, so if some of y'all have to bounce, I understand. Basically, after I told my family, I have a relatively small family. My mom was an only child, and then I have one brother and a stepbrother. So it's like, it's like not a whole bunch of people in my family. But my brother lived in Indiana at the time. He decided that he needed to come into town for this surgery. Now, he is my medical person. I have my emotional person. He's my medical person. He's the person who's on all of the forms and all of the whatever, and this is who makes medical decisions for me. Is my brother. So he felt like he should be in town because of the fact that he is that person in my life. And so he gunned it from Indiana into town. So then I told my dad, and I'm my dad's only child. I'm not my mom's only child, but I am my dad's only child. And all he had to hear was cancer, and he's like, I'm coming to Baltimore. So I appreciated that, although the fact was that at the time my dad was like sort of down on his luck. It's probably more of my business than you want to know. He was down on his luck. He was staying in a veterans shelter. He didn't want to come stay with me because he didn't want to burden me. He lives in New York City. The shelter only allows you to have like a 48-hour pass. So he was coming the day before my surgery, and then he would have to leave the day after my surgery, which meant that I couldn't take him back to the bus station or whatever. So I was trying to sort of push him to come later, but he, look, this is his baby, and, she has breast cancer. all bets are off the table. So he, funny story is when I pick him up from the Greyhound station, one of the things that I did do before my surgery was that I had my wig taken off. Those of you who have followed Bariatric Foodie for a while know that I don't have any hair of my own. I have alopecia totalis, so I'm about as bald as the day I was born. So I wear a hair replacement system, which needs to be maintained right now because it looks a hot mess. Next week's probably Bariatric Foodie Live. I'll be looking like all Farrah Fawcett and everything. But I had my wig taken off because hair replacement wigs are expensive. They run in the thousands of dollars. And, thankfully I was able to get insurance to help me out with mine, but I was not messing that wig up to lay up after surgery. So I had the wig taken off. And so I'd been wearing a scarf around my head. And I go to pick up my dad, and it was just too much for him. He knows his child has cancer. Then he sees me with the scarf tied around my head. I'm bald. It was just too much. He didn't know enough about cancer to know that it wasn't like a chemotherapy thing. He just lost it. Meantime, I hadn't lost it at any point even up through all of the pre-op testing. Between the first diagnosis and my mastectomy, I would venture to guess I had probably between 12 and 14 mammograms. They had to do a mammogram after every single test that I got. And so to make sure that they had images of what had changed. I had an incident. I fainted for the very first time during my preoperative procedures because they had this thing where they had to stick these they look like really long acupuncture needles into my breast to be able to actually, because of the location of the lump, which is why they couldn't find it in the first place, they had to stick like these pins in my breasts to take an image of them. The fight or flight reflex kicked in. My brain thought that it was going to be excruciatingly painful for them to put these pins in, even though I barely felt it. And so I fainted. I had my first experience with smelling salts as a result. Disgusting. If you can avoid it, don't faint. That's really nasty. It tastes like ammonia. I mean, not tastes like, it smells like ammonia times like a million. So, I hadn't lost it though up until then, but the moment that I had my sort of woosah moment was the morning of my surgery. My boyfriend, a couple days earlier, this was a hot mess, actually, the way this shook out. My boyfriend has stage 4 kidney disease as a result of diabetes. And so he had to get a dialysis catheter inserted by minor surgery. So he had that minor surgery a couple days before I had major surgery. We had gone out to dinner the night before my surgery. Everybody's in town. My dad's in town. My brother's in town. His wife, my niece, all of these people are in town. And we go to dinner. We stayed out pretty late, and he was in a lot of pain because he had moved just way more than he was supposed to that day. So I think he took a little bit of extra pain meds. So the next morning we wake up for surgery, and my best friend was to pick me and my boyfriend up and take us to the hospital, but I could not get this man to wake up to save my life. So basically I left him a note saying, when you wake up, head to the hospital. I had to go. I'll see you there. I love you. So I wasn't sure if there was going to be anybody at the hospital with me. I'm dialing my girlfriend, who is my person. And to this day, she says she feels bad about that because she was just really tired. So, she had turned her cell phone off. So I'm dialing her. I'm dialing my sister-in-law. I'm dialing all of these people. Nobody's answering the phone. I get to the hospital. I check in for my surgery, and they send me down to the surgery center. And that, friends, is where Nikki lost her cookies. I had the most ugly cry, anxiety attack, can't breathe, puffy face, snot coming out of my nose, tears flinging everywhere, hyperventilating moment. So I get off the hospital, off the elevator to go to the surgery center. They see this, which probably wasn't a good sight for other people who are having surgery, that I'm going into surgery looking like this. So they sort of usher me back to the triage area, not the triage area, the area where they, get you ready and prepped up for surgery, and had me sort of put on my hospital gown. The whole time I'm just bawling my eyes out, and eventually my surgeons came in to mark me up, and if you can imagine the scene, they had to mark up my breasts, both of my breasts, to know where they're doing the surgery. And they come in, I'm having this panic attack. So the first thing they both do, because they're both empathetic people, was they gave me a hug. So I'm here with these two sort of older surgeons, surgical markers in hand, hugging me with no shirt on. It was a scene. So finally, my sister-in-law, she got the message. She sped to the hospital. They got her into the room, and I had the surgery. So what is life like afterward? Well, first of all, let me tell you how the surgery shook out. It shook out that I was able to have and you guys are seeing the opposite, because of the mirror flip, whatever that is. But my left side was able to be fully reconstructed. My left side is the side that did not have the cancer. So I had a bunch of reconstructive options, and I'll go over those another day because we are running over, but I had a bunch of reconstructive options, some of which involved using my own body to reconstruct my breasts, and some of them involving implants. I chose to get implants because it was the least extreme thing that I could do. There were, like I said, there were a couple of other methods they could have done, but I decided not to do that. So this side got completely reconstructed. There's an implant in there. It's good. It's fine. My right side is the side that had cancer, and they decided that they also needed during the surgery to take one of my lymph nodes to test them along with the pathology report. They took what's called the sentinel lymph node. A sentinel lymph node is a lymph node that would get the cancer cells first. So if the sentinel lymph node is clear, pretty much assume that all of the rest of the lymph nodes, there's no cancer in it. So that side I was not able to get reconstructed because of the fact that they had to take a good amount of skin and tissue. And so they put what is called a tissue expander in instead. And the tissue expander's job is just what it says, to expand the tissue. Its job is to stretch your skin so that eventually there will be enough skin to have an implant. Warning, squeaky moment number 2 coming up. I was told that now mastectomies can either attempt to be nipple sparing or non-nipple sparing. I was told that I was going to have a non-nipple sparing mastectomy, which meant that I would go into surgery and I would come out and I would not have nipples anymore. I think the very first thing that I noticed when I awakened from surgery is that, yes, I did in fact still have one on my left side. It was very pronounced. It was like, hello. So that was an interesting thing for women who've had mastectomies. There's different ways to handle that. Some women just sort of leave it alone after they get reconstruction. Some get a tattoo of the nipple on the breast and things like that. I haven't exactly decided what would happen for me. And part of the reason why I haven't decided yet is because my reconstruction is actually not finished yet. I've had some problems with insurance, not necessarily with my insurance, but with, who's covered, who's not covered. That's another thing. Anytime that you have any sort of major surgery coming up, just double, triple, quadruple check your coverage and your providers and your coverage and your providers, because as it turned out, my reconstructive surgeon was not in network. And so there's been like a lot of hoopla of whether he's going to continue my reconstructive process, whether he was going to hand me off to another surgeon. I tried to go to another surgeon. The other surgeon said that the other surgeons in my network basically said we would prefer not to operate on somebody else's operation. We would prefer for you to stay with the surgeon that you have. So we're still trying to sort all of this mess out. Here we are in October 2017. I had my surgery in May of 2016. So I still actually have the tissue expander on this side. Having a tissue expander is extremely uncomfortable. It's hard to sleep. If you can imagine, the best way I can describe having a tissue expander is, I don't know if you've ever, if you guys have ever been to Chuck E. Cheese and, the Nerf ball pit, like where they have those really hard Nerf balls. That's what the tissue expander kind of feels like. It feels like a really hard Nerf ball that's under your skin that's kind of heavy. And so it makes it hard to, I was a stomach sleeper before, man. I miss sleeping on my stomach, but I can't do it anymore. But it causes discomfort, and progressively, the longer that the tissue expander is in there, it sort of stretches out my arm muscles. My arm doesn't quite work right. I can't I can't do this with that arm. So I can't do this with that arm. Those are ranges of movement that I just physically can't do. And if I try to, it hurts very bad. So that's sort of been what afterlife is for me. So you are going to hear me talk about, hopefully, way in advance of the Bariatric Foodie Pledge. That's like sort of my little heart palpitations. Although, let me just preface this by saying that I know that I have to take care of myself first. And if it comes to the jump, I will take care of myself first. But I am in the process of planning the 2018 Bariatric Foodie Pledge. And I'm like, watch this surgery be like in February. So I'm like, whew. For those of you who don't know, the Bariatric Foodie Pledge is a 4-week goal setting and accountability challenge that we do every year on Bariatric Foodie. And you get to win prizes every single week of those 4 weeks for making a healthy goal and holding yourself accountable. It's a huge deal. A lot of people participate, and it would just be really stressful to my life if I was undergoing surgery in February. So let's all swing a collective chicken that Nikki gets her surgery to come through before then. But that's pretty much what the afterlife has been for me. Some of the questions that people tend to ask me about reconstruction, and by the way, let me do my takeaways and then I'll do that. So takeaway number 1 for after treatment is I went through something and it'll take a while to process it. I'm still processing my diagnosis process. I have a tendency to say that I had little baby cancer. And a friend of mine pointed out to me about a week ago that I should stop saying that. No, you had cancer. You had cancer, even though it was stage 0. I did not have to go. My pathology report came back that that they got all of the cancer. After you have the mastectomy, what they're looking to do is do something called clearing the margins, which means they've got all the cancer out there, and they're reasonably sure there's no cancer left in there. They believe that they cleared the margins on my surgery. My lymph node came back clean. I did not have to undergo any radiation. There was a chance that I would have had to still undergo radiation. I didn't have to go on tamoxifen. I didn't, obviously with stage 0, you aren't in the realm of chemotherapy or anything. So my mastectomy was effectively the end of my cancer treatment. I do still have to go back to my breast surgeon every 6 months for the rest of my life, and I do still have to be monitored because there is that very small percentage of a chance that the cancer can come back. But that was the end of my cancer treatment. And so I was so focused on surgery and recovering from the surgery and all of that good stuff that it's just sort of hitting me now, a year and a half later, that I went through some stuff. And it's traumatic. And, I reached out for help. I will tell you that, because I have been going through sort of random anxiety moments. My body has changed hormonally. My cycle isn't the same. And one of the most marked ways that it isn't the same is because of mood swings. Like I have 2 days during my cycle now where I, for whatever reason, this has never happened to me before, just cry uncontrollably. And I'm not even really upset about anything. I just cry and cry and cry. I know those days are coming now because I've been tracking it, but it's like your body is going through something. This is a new reality. The whole breast thing is interesting because of the fact that, I now have these, I don't have breast tissue anymore. Those of you who have had plastics, will know that sometimes you get numb spots from when you have that kind of surgery. Well, I was kind of thankful for the whole nipple thing, because that's like the one thing that equates the fact that my breasts are still a part of my body, because I can't feel that. When I do that, I can't feel it. So, or wait a minute here, I'll hide this. And I can't feel that. Like I can feel it on my fingers. I can't feel it on my breasts. So that's the only place where I have any sort of feeling on my breasts. All of that stuff has a psychological impact on you. So I go to my cancer support group. I have, I'm in between therapists now, but I have been talking to, my doctors, my mental health professionals, my clergy, my friends, because you should not try to go through and process these things, on your own. Takeaway number 2, good health is measured in more than just pounds. One of the things that was great about my recovery is that everybody was like, you recovered like a champ. Your body did great. Your body is doing exactly what it's supposed to be doing in recovery. One of the interesting things that happened with my body in recovery from major surgery was the fact that I was hungry all the freaking time, which my doctor said was completely normal. Your metabolism is speeding up because you're trying to heal from something. But, the fact that I was able to get back into a routine of walking and getting into a routine of, trying to be active again and, bouncing back. It's like good health is measured in more than just pounds. It meant a lot to me that I was able to do those things as soon as I was able to, because it started to make life seem a little bit more normal. Takeaway number 3, knowledge is power, time is invaluable. Again, don't stick your head in the sand if you think something is wrong. The more time you can give yourself, I was able to, sort of mull over my treatment options a little bit, but, the earlier you can catch breast cancer, the more curable it is, and that's what you want, that time. So anyway, I wanted to sort of conclude with a top 5-ish sort of ways that you can be empowered about breast cancer. So if you leave with nothing else from this session, these are the top 5-ish things I want you to leave with. I know I've been counting down things a lot in this one, but I want to make sure that I organize my thoughts because I can be a little bit all over the place when I tell these stories. Number 1 is do your self exams and ask for help knowing what your breasts should feel like. If you've lost a lot of breast mass as a result of weight loss surgery, it might be worth next time you go to your gynecological appointment and they're doing the breast exam, feel right along with them and say, like, my breasts have changed. I've lost a lot of weight. What am I feeling for? What's good? What's bad? What's normal? Because everything feels lumpy to me in there. So have your doctor go through with you and tell you what your breasts should feel like, because that's important. Number 2, don't you dare skip that. If I find out about any of y'all who are due for a mammogram, skipping your mammogram because it's a pain in the butt or you don't feel like getting your breast squeezed or whatever, I'm coming for you and I'm going to let you know that right now. Don't you dare skip that mammogram. If you are 40 years old, you should be having a mammogram either every 1 or 2 years. If you have risk factors, you need to, next time you go to your doctor, tell your doctor that, and you can make a determination of when you need to start having your mammogram if you've had a family member who had breast cancer or whatever. But don't you dare skip that mammogram. Number 3, if you think something's wrong, again, I said I'm going to beat this point into the ground. Don't stick your head in the sand. Go for the tests. This is why having a person is good, because they will prod you to go for the tests, even if you're really scared and nervous. But don't stick your head in the sand. Follow through with your appointments. Do what you need to do to find out what you need to find out. Number 4, if you can help it, don't go through diagnosis alone. Heck, if any of you ever have like a situation where you don't feel like you can tell anybody else, email me and I will, accompany you throughout. Obviously, I can't be everywhere across the country, but I will check in on you. So if you can help it, don't go through diagnosis alone. Number 5, talk to your doctor about your risks and follow those best practices. Please, 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 please. If your mom had breast cancer, mention that to your doctor, because that means you probably need to start getting screened 10 years before the age that she was diagnosed. If you have your grandma or your auntie or whoever, tell them that too, because that increases your risk factor, and then go with the best practice associated with your particular risk. Oh God, bug. So with that, I don't know that anybody has any burning questions, but if you do have any questions, feel free to ask about them now. I just want to, in conclusion, just say thank you guys, because everybody from Bariatric Foodie was so supportive throughout my diagnosis process. I can't even tell you. I had foodies who sent me cards. I had foodies who were, emailing me to make sure that I was okay. I had foodies, there was like this whole Facebook thread the day of my mastectomy, where people were giving me support and love. And guys, you guys are awesome any day of the week, but that in particular just warmed my heart, touched my heart, and it made me feel not alone at all. I didn't feel alone at all. I had my family with me, and I had you guys praying for me and sending positive thoughts. But also just the opportunity to be able to take some time off. And it was really significant to me because my mastectomy, it was on May 5th, which is actually a pretty significant day. I thought it was like sort of one of those universe aligning in a weird way sort of things, because May 5th is my grandfather's birthday, the grandfather who lost his wife to breast cancer, the grandfather who pushed me to be aware of breast cancer my whole life, and my mastectomy ended up on his birthday. So it sort of felt like an homage to my grandfather. And before I went into surgery, before they gave me the anesthesia and everything sort of blacked out, I remember sort of thinking in my head, we did it, Pop Pop. We did it, because that was his fondest wish. He sort of conveyed to me, not if you get breast cancer, but when you get breast cancer, and you're going to catch it early and you're going to get rid of it. And I felt like, he was smiling down because we got it early. I am still here to tell the tale, and I am so very thankful to everybody who is involved in that. So again, thank you, thank you, thank you. That's where I'm going to end things, because I'm now at an hour and 15 minutes of this live. But if you have any questions about breast cancer, about a diagnosis, about a mammogram, you can always reach out to me. You guys know my email, nikki@bariatricfoodie.com. Reach out to me here on the page, message the page, whatever you need to do. But get the information that you need to get, and know that you are not alone in this process. So with that, I'm going to say thank you. I'm going to say good night. Thank you for hanging out with me for an hour and 15 minutes. Please, please, please remember that if you tune in next week, me and Bariatric Pal have a little gift for you. So Shannon and I will be back. Shannon, like I said, send healing vibes for Shannon, but Shannon and I will be back next Thursday at 8 p.m. Eastern Standard Time for the next episode of Bariatric Foodie Live, and I will see you guys then. So good night, and have a good night, everybody.